Treacher Collins Syndrome is a condition that affects the development of the bones and tissues of the face. Most individuals will have underdeveloped cheekbones, a small jaw, downward slanting eyes, with possible vision loss. The purpose of this video, however, is to focus more on the audiological aspects of Treacher Collins, which is often characterized by absent, small, or unusually formed ears, referred to as microtia. TCS patients possess bilateral abnormalities of the pinna. They may have an underdeveloped or absent external auditory canal, defects with the tympanic membrane, and the middle ear space where the ossicles reside. The following pictures represent different grades of microtia seen with TCS patients. In grade 1, you'll see a smaller than normal ear, but mostly a normal anatomy. Grade 2 will have parts of a normal ear. The AC may still be normal at this level, possibly smaller in diameter or completely closed. Grade 3 is often just a small amount of what remains of skin and cartilage. The absence of the ear canal is called an oral atresia. Grade 4 is the complete absence of the pinna and the EAC. Treacher Collins can be detected with an ultrasound while the mother is still pregnant. After birth, a physical examination may take place with the presence of an external auditory canal or a degree of the oral atresia. The newborn hearing screening program should include an auditory brainstem response, ABR, and an otoacoustic emissions test to detect any vibration leakage if an external canal is present. Genetic testing will also take place to rule out other syndromes similar to TCS. Treatment for the audiological problems that come with TCS may include reconstructive surgery on the pinna and the EAC. Reconstruction of the ear canal would allow for normal hearing aids. However, a bone-anchored hearing aid is often chosen if surgery is not necessary. The bone-anchored hearing aid will transmit sound directly through the bone and into the cochlea, bypassing the outer ear completely. This audiogram sample comes from a 4-year-old girl who has mild outward appearance of TCS features. Her ears were a grade 1 and grade 2 microtia. Microscopic inspection showed a malleus imprint in the eardrum that was probably free-floating and did not represent the malleus handle. The right ear canal narrowed to approximately 3 millimeters, making it difficult to see a smaller eardrum. No ossicular landmarks could be identified. Test findings resulted in a bilateral conductive hearing loss with greater severity in the right ear. Speech recognition scores were within the normal limits for both AC and BC speech stimuli. Because of the age and reliability of the patient, ABR measures were undertaken to confirm behavioral testing using standard AC and BC click protocol. The child currently wears bilateral post-auricular hearing aids and is doing well in school. This case study underscores the fact that in TCS, there is no guarantee that middle ear structures had developed normally in the presence of only mild external ear and auditory canal pathology, meaning grade 1 and grade 2 microtia. A handful of disorders share similarities to Treacher Collins syndrome when it comes to the physical features of the face. However, Goldenhar syndrome shares microtia and other ear abnormalities when reviewing the audiological similarities to TCS. This syndrome is also characterized by the incomplete development of the ears, along with the nose, the soft palate, lips, and the mandible. Just to recap all the points we hit for Treacher Collins syndrome, it does come with an underdeveloped or absent external ear canal, defects of the tympanic membrane, and possible defects of the middle ear space. Detection before birth is accomplished with an ultrasound. Screening programs include the auditory brainstem response and the otoacoustic emissions test, as well as genetic testing. Possible therapies include reconstructive surgery, which is mostly cosmetic unless the external ear canal is rebuilt. This does not guarantee middle ear function. The most common type of hearing aid used is going to be the bone-anchored hearing aid, and that's usually because of the absence of the EAC. We looked at sample audiograms that showed that even when TCS is mild on the outside, that does not represent the internal auditory structures within the ear. TCS does share similarities with other syndromes, but is still a very interesting syndrome all on its own.